Question 1. A licensed practical nurse, LPN, is assisting with the admission of an older adult client to a long-term care facility. The client appears disoriented and has difficulty answering questions about their personal history. Which action should the LPN prioritize? I. Request a consult for a psychiatric evaluation. B. Obtain the client's medical history from family members. C. Administer a sedative to calm the client. D. Document the client's disorientation and defer the admission interview. Answer B. Obtain the client's medical history from family members. This question tests your understanding of initial assessment principles and the LPN's role in gathering information, especially when a client cannot provide it directly. The keyword prioritize indicates the most important first step. When a client is disoriented, obtaining information from a reliable source like family members is crucial for safe and effective care, providing essential medical history and baseline cognitive function. For instance, knowing if this disorientation is new or typical helps the care team. Always remember to seek out alternative sources of information when the client cannot fully participate in their care. Question 2. The nurse is preparing to administer an oral medication to a client. The client asks, "What is this medication for?" Which response by the nurse is most appropriate? I. It's a medication your doctor prescribed for your heart. B. You should ask your doctor about that. C. This medication is metoprolol, and it helps to lower your blood pressure. D. Just take it. It will help you feel better. Answer C. This medication is metoprolol, and it helps to lower your blood pressure. This question assesses the nurse's understanding of medication administration rights and effective client education. The most appropriate response involves identifying the medication and explaining its purpose in clear, simple terms. Telling the client the name of the medication and its action, like, "This medication is metoprolol, and it helps to lower your blood pressure," empowers them with knowledge and fulfills the right-to-know aspect of medication administration. Always ensure clients understand what they are taking and why, as this promotes adherence and safety. Question 3. A client with a new prescription for an antibiotic reports developing a rash and itching after the first dose. Which action should the licensed practical nurse, LPN, take first? I. Document the reaction in the client's chart. B. Administer an antihistamine as ordered. C. Notify the primary healthcare provider. D. Administer the next scheduled dose as usual. Answer C. Notify the primary healthcare provider. This question focuses on recognizing and responding to potential adverse drug reactions, a critical safety concept. The keywords rash and itching after the first dose signal a potential allergic reaction. The LPN's first action should be to notify the primary healthcare provider because a new rash and itching after medication could indicate an allergic response that requires immediate medical evaluation and a potential change in treatment. This ensures the client's safety and prevents the administration of further doses of a potentially harmful medication. Always remember to report new adverse reactions promptly to the healthcare provider. Question 4. A client reports experiencing pain level 7 on a 0 to 10 scale after surgery. The LPN assesses the client and notes shallow breathing and grimacing. The client is due for pain medication. What is the most appropriate action for the LPN to take? I. Document the pain level and reassess in 30 minutes. B. Encourage the client to try distraction techniques. C. Administer the prescribed pain medication. D. Inform the client that pain is expected after surgery. Answer C. Administer the prescribed pain medication. This question tests the LPN's ability to assess pain and intervene appropriately within their scope of practice. The client's self-reported pain level of 7/10, along with observable signs like shallow breathing and grimacing, indicates significant discomfort requiring intervention, and the question states the client is due for pain medication. Therefore, the most appropriate and immediate action is to administer the prescribed pain medication to alleviate the client's pain. Providing timely pain relief improves client comfort and prevents potential complications from unrelieved pain, like respiratory compromise from shallow breathing. Question 5. Which finding observed by the licensed practical nurse, LPN, for a client who is NPO, nothing by mouth, and has a nasogastric tube to low intermittent suction should be reported to the registered nurse RN immediately? I. The client complains of thirst. B. Output from the nasogastric tube has decreased. C. The client's abdomen is distended and firm. D. The client requests to watch television. Answer C. The client's abdomen is distended and firm. This question tests the LPN's ability to identify critical findings that require immediate escalation, especially concerning clients with nasogastric tubes. The keywords NPO, nasogastric tube to low intermittent suction, and immediately highlight the urgency and the potential for a serious complication. An abdomen that is distended and firm in a client with an NG tube to suction suggests a potential obstruction, alias lack of normal muscle contractions in the intestine, or other serious abdominal issue, which could lead to severe complications if not addressed quickly. While thirst and decreased output are important to note, a distended and firm abdomen indicates an acute change in condition requiring prompt RN assessment and provider notification. Question 6. A client asks the LPN, "Why do I need to take this blood pressure medication even though I feel fine?" Which response demonstrates an understanding of health education? I. Many people feel fine even with high blood pressure, but it can still damage your organs. B. Your doctor ordered it, so you should just take it. C. If you don't take it, you might have a stroke. D. I don't know, but I can ask the doctor to explain it. Answer I. Many people feel fine even with high blood pressure, but it can still damage your organs. This question evaluates the LPN's role in client education, particularly regarding chronic conditions that may lack obvious symptoms. The keyword why indicates the client is seeking information about the medication's necessity. The most effective response educates the client about the silent killer nature of hypertension, high blood pressure, by explaining that feeling fine does not mean the condition isn't causing internal harm to organs like the heart, kidneys, and brain. This type of explanation helps the client understand the importance of adherence, even without symptoms, promoting better long-term health outcomes. Question 7. The LPN is preparing to administer an intramuscular injection to an adult client. Which needle gauge and length are generally most appropriate for an average adult receiving an IM injection? I. 25 gauge, 1-inch needle. B. 18 gauge, 1.5-inch needle. C. 22 gauge, 1.5-inch needle. D. 30 gauge, 1/2-inch needle. Answer C. 22 gauge, 1.5-inch needle. This question tests basic knowledge of medication administration equipment and proper technique for intramuscular injections. For an average adult receiving an IM injection, a 22 gauge, 1.5-inch needle is generally appropriate because the 22 gauge allows for sufficient medication flow, and the 1.5-inch length is typically enough to reach the muscle layer in most adults, ensuring proper delivery. While smaller gauges, like 25, might be used for thinner individuals or specific medications, and larger gauges, like 18, are for thicker solutions or rapid administration, the 22 gauge, 1.5-inch is a common and safe choice for IM injections. Remember, selecting the correct needle size is crucial for effective medication delivery and client comfort. Question 8. A client has a prescription for a clear liquid diet. Which food item is appropriate for the LPN to offer this client? I. Orange juice with pulp. B. Chicken broth. C. Milk. D. Applesauce. Answer B. Chicken broth. This question assesses knowledge of therapeutic diets, specifically a clear liquid diet. The keyword clear liquid diet implies that all items must be transparent and liquid at room temperature. Chicken broth fits this criterion perfectly, as it is clear and liquid. Orange juice with pulp, milk, and applesauce are not considered clear liquids because they are opaque or contain solids, which are not permitted on this type of diet. Think of it this way. If you can read a newspaper through it, it's a clear liquid, which is useful after surgery or before certain diagnostic tests. Question 9. The LPN is caring for a client who is receiving intravenous for fluids. The client reports pain and swelling at the foresite. Upon assessment, the LPN notes coolness and paleness around the site. What complication does the LPN suspect? I. Phlebitis. B. Infection. C. Infiltration. D. Allergic reaction. Answer C. Infiltration. This question tests the LPN's ability to identify common complications based on signs and symptoms. The key signs mentioned are pain and swelling at the foresite, coupled with coolness and pallor around the site. These symptoms are classic indicators of infiltration, which occurs when the fluid leaks out of the vein and into the surrounding subcutaneous tissue. Phlebitis would present with warmth and redness, infection with purulent drainage and fever, and an allergic reaction with widespread rash or respiratory issues. Recognizing these specific signs helps ensure prompt intervention, such as discontinuing the and applying a warm compress to prevent further tissue damage. Question 10. A client with a colostomy asks the LPN for guidance on choosing appropriate foods to prevent gas and odor. Which food choice should the LPN advise the client to limit? I. Yogurt. B. Bananas. C. Broccoli. D. Cranberry juice. Answer C. Broccoli. This question assesses the LPN's knowledge of dietary considerations for clients with colostomies, focusing on preventing common issues like gas and odor. The keyword limit indicates a food that should be consumed sparingly. Broccoli, like other cruciferous vegetables, cabbage, cauliflower, Brussels sprouts, is known to produce intestinal gas and strong odors, making it a food to limit for individuals with a colostomy. Yogurt and cranberry juice can help reduce odor, and bananas are generally well tolerated. Helping clients understand these dietary adjustments is crucial for their comfort and quality of life. Question 11. The LPN is preparing to administer medication to a client via a gastrostomy tube. After checking the tube placement, which action should the LPN perform next? I. Flush the tube with 30 milliliters of water. B. Administer the medication rapidly. C. Clamp the tube immediately after medication administration. D. Mix all medications together before administration. Answer I. Flush the tube with 30 milliliters of water. This question tests the LPN's understanding of proper medication administration technique via a gastrostomy tube. The keyword next, after checking tube placement, indicates the sequential step. After confirming proper tube placement, flushing the tube with 30 milliliters of water is essential to clear the tube, ensure patency, and prepare it for medication administration, preventing medication from sticking to the tube walls. Administering medication rapidly can cause cramping, and mixing all medications together is often inappropriate due to potential incompatibilities. Always flush before and after medication administration through a tube to ensure efficacy and maintain tube patency. Question 12. A client is prescribed to receive 500 milligrams of acetaminophen orally every 4 hours as needed for pain. The pharmacy supplies 250 milligrams tablets. How many tablets should the LPN administer for each dose? I. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. Answer B. 2 tablets. This question tests basic dosage calculation skills, a fundamental concept in safe medication administration. The client needs 500 milligrams, and each tablet contains 250 milligrams. To find out how many tablets to administer, divide the desired dose by the dose available per tablet. 500 milligrams / 250 milligrams per tablet equals 2 tablets. Accurate calculation ensures the client receives the correct and safe dose of medication. Always double-check your calculations to prevent medication errors, which can have serious consequences. Question 13. Which action best demonstrates the licensed practical nurse's, LPN, commitment to maintaining client confidentiality? I. Discussing a client's condition with another LPN in the hallway. B. Sharing a client's progress with their immediate family without consent. C. Ensuring client medical records are securely stored and not left visible. D. Posting about interesting client cases on a private social media group. Answer C. Ensuring client medical records are securely stored and not left visible. This question focuses on the crucial ethical and legal principle of client confidentiality. The keyword best demonstrates asks for the most effective action. Ensuring client medical records are securely stored and not left visible prevents unauthorized access to protected health information. Discussing client conditions in public areas, sharing information without consent, or posting on social media are all breaches of confidentiality and are unacceptable. Always remember that protecting a client's privacy is a fundamental responsibility of all healthcare professionals. Question 14. An LPN is teaching a client about preventing falls at home. Which statement by the client indicates an understanding of the teaching? I will keep the lights dim to help me sleep better. B. I will use throw rugs to make my home feel cozier. C. I will make sure my walking paths are clear of clutter. D. I can just hold onto furniture if I feel unsteady. Answer C. I will make sure my walking paths are clear of clutter. This question assesses the LPN's ability to evaluate client understanding of fall prevention strategies. The statement that indicates understanding is, I will make sure my walking paths are clear of clutter. Clutter on floors creates trip hazards, which are a major cause of falls, especially for older adults or those with mobility issues. Keeping paths clear directly reduces the risk of tripping. Dim lights, throw rugs, and holding on to unstable furniture all increase the risk of falls, making them incorrect choices. Always educate clients to remove hazards and ensure a safe environment to prevent injuries. Question 15. The LPN observes a client who is visibly upset and tearful. The client states, I just don't know why this is happening to me. Which therapeutic communication technique should the LPN use? Everything will be okay. Try not to worry. B. It sounds like you're feeling overwhelmed right now. C. Why are you so upset about this? D. Let's talk about something more positive. Answer B. It sounds like you're feeling overwhelmed right now. This question tests the LPN's understanding of therapeutic communication, particularly when a client is expressing distress. The keyword, visibly upset and tearful, indicates emotional vulnerability. The most therapeutic response is to acknowledge and validate the client's feelings, such as, it sounds like you're feeling overwhelmed right now. This technique, known as reflection or empathizing, shows that the LPN is listening and understands the client's emotional state, which encourages further communication. Avoid false reassurance. Everything will be okay, asking why questions which can sound accusatory, or changing the subject, as these can block effective communication. Question 16. A client has a history of congestive heart failure, CHF. The LPN notes the client has gained 3 pounds in 24 hours and has crackles in the lung bases. Which intervention should the LPN anticipate? Increasing the client's fluid intake. B. Administering a prescribed diuretic. C. Encouraging a high-sodium diet. D. Documenting the findings and monitoring. Answer B. Administering a prescribed diuretic. This question assesses the LPN's ability to recognize signs of fluid overload in a client with CHF and anticipate appropriate interventions. The keywords gain 3 pounds in 24 hours and crackles in the lung bases are classic signs of fluid retention and worsening CHF. These findings indicate the need to remove excess fluid from the body. Therefore, the LPN should anticipate administering a prescribed diuretic, which helps the kidneys excrete excess fluid, reducing the workload on the heart and improving respiratory status. Increasing fluid intake or a high-sodium diet would worsen the condition. Question 17. The LPN is reinforcing teaching with a client about proper hand hygiene. Which statement by the client indicates a need for further instruction? I should wash my hands for at least 20 seconds. B. I can use hand sanitizer if my hands are visibly dirty. C. I should use soap and water when my hands are soiled. D. I will rub my hands together vigorously after applying soap. Answer B. I can use hand sanitizer if my hands are visibly dirty. This question focuses on infection control and proper hand hygiene techniques. The statement, I can use hand sanitizer if my hands are visibly dirty, indicates a need for further instruction. Hand sanitizer is effective for hands that are not visibly soiled. When hands are visibly dirty, contaminated with bodily fluids, or after using the restroom, soap and water are required to physically remove microbes and dirt. Washing for at least 20 seconds, using soap and water for soiled hands, and vigorous rubbing are all correct techniques. Always remember that visible dirt requires soap and water for effective cleaning. Question 18. An older adult client reports difficulty sleeping and frequent nighttime awakenings. Which suggestion should the LPN provide to promote better sleep hygiene? I. Encourage daily naps to catch up on sleep. B. Advise consuming a warm alcoholic beverage before bed. C. Suggest engaging in light exercise in the late evening. D. Recommend establishing a regular bedtime and wake-up schedule. Answer D. Recommend establishing a regular bedtime and wake-up schedule. This question tests knowledge of promoting healthy sleep habits, especially for older adults. The keyword promote better sleep hygiene points to strategies for improving sleep. Establishing a regular bedtime and wake-up schedule, even on weekends, helps regulate the body's natural sleep-wake cycle, circadian rhythm, making it easier to fall asleep and wake up consistently. Daily naps can disrupt nighttime sleep, alcohol interferes with sleep quality, and late evening exercise can be stimulating, making it harder to fall asleep. Consistency is key for good sleep. Question 19. A client is scheduled for a wound dressing change. The LPN notes the client is exhibiting signs of anxiety, including rapid breathing and restlessness. What is the best initial action for the LPN to take? I. Tell the client to calm down and relax. B. Administer a prescribed anti-anxiety medication immediately. C. Explain the procedure and answer any questions the client may have. D. Proceed with the dressing change quickly to get it over with. Answer C. Explain the procedure and answer any questions the client may have. This question assesses the LPN's approach to client care when anxiety is present, particularly before a procedure. The keyword best initial action asks for the most appropriate first step. When a client is anxious about a procedure, providing clear information about what will happen, why it's necessary, and answering their questions helps reduce fear of the unknown and gives them a sense of control. This therapeutic communication can often alleviate anxiety more effectively than medication or dismissive comments. Always remember to educate and reassure clients before procedures to promote comfort and cooperation. Question 20. The LPN is caring for a client with type 2 diabetes who has a fasting blood glucose of 180 milligrams per deciliter. The client states, I thought my diabetes was under control. Which response by the LPN is most appropriate? I. That level is a bit high. We need to check your diet. B. A single high reading doesn't mean your diabetes isn't controlled, but it's something to monitor. C. Your diabetes is clearly not under control if your blood sugar is that high. D. Are you sure you followed your diet and exercise plan yesterday? Answer B. A single high reading doesn't mean your diabetes isn't controlled, but it's something to monitor. This question evaluates the LPN's communication skills and ability to provide accurate and supportive client education regarding chronic conditions. The client expresses concern over a single elevated reading. The most appropriate response is to provide reassurance while also emphasizing continued monitoring. A single high reading can be influenced by many factors and doesn't necessarily indicate a complete loss of control but warrants further attention and discussion with the healthcare provider. This approach avoids judgment and encourages collaboration, reinforcing that diabetes management is an ongoing process. Question 21. A client reports a sudden onset of severe headache, blurred vision, and dizziness. The LPN observes the client's blood pressure is 180/100 mmHg. Which action should the LPN take first? A. Offer the client a cool cloth for their forehead. B. Document the findings in the client's chart. C. Notify the registered nurse, RN, or primary healthcare provider immediately. D. Recheck the blood pressure in 30 minutes. Answer C. Notify the registered nurse, RN, or primary healthcare provider immediately. This question tests the LPN's ability to recognize and prioritize critical symptoms. The combination of sudden onset of severe headache, blurred vision, dizziness alongside blood pressure 180/100 mmHg suggests a hypertensive crisis or another serious neurological event requiring urgent medical attention. Notifying the RN or primary healthcare provider immediately is the first and most critical action because these symptoms, especially with such elevated blood pressure, can indicate a life-threatening emergency. Other actions like documentation or rechecking are important but come after notifying the appropriate professional for prompt intervention. Question 22. The LPN is assisting a client with ambulation after surgery. The client reports feeling lightheaded and weak. What should the LPN do first? A. Continue walking slowly to build endurance. B. Encourage the client to take deep breaths. C. Guide the client to a nearby chair or safely lower them to the floor. D. Call for immediate assistance from another staff member. Answer C. Guide the client to a nearby chair or safely lower them to the floor. This question assesses immediate safety interventions during ambulation. The keywords lightheaded and weak indicate a potential for syncope, fainting, or a fall. The first priority is always client safety. Guiding the client to a nearby chair or safely lowering them to the floor prevents a fall and potential injury. While calling for assistance is important, ensuring the client's immediate safety from a fall takes precedence. Continuing to walk or just deep breathing does not address the immediate fall risk. Always protect the client from falling as your first response to dizziness or weakness during ambulation. Question 23. An LPN is administering medications and notes that a client's prescribed dose of medication is significantly higher than the typical range. What is the most appropriate action for the LPN to take? A. Administer the medication as prescribed. B. Administer a lower, more typical dose. C. Clarify the order with the primary healthcare provider. D. Ask another LPN if they think the dose is correct. Answer C. Clarify the order with the primary healthcare provider. This question focuses on medication safety and the LPN's responsibility to question unusual orders. The keyword significantly higher than the typical range identifies a potential medication error. The most appropriate and safest action is to clarify the order directly with the primary healthcare provider to ensure the dose is indeed intended. Administering an unusually high dose without clarification could harm the client, while administering a lower dose is also a medication alteration. Always use your critical thinking to question orders that seem incorrect or unsafe, ensuring the right dose is truly right. Question 24. A client with a new diagnosis of hypertension is asking about lifestyle changes to manage their condition. Which dietary recommendation should the LPN emphasize? A. Increasing sodium intake. B. Limiting fresh fruits and vegetables. C. Reducing processed foods and red meat. D. Consuming more high-fat dairy products. Answer C. Reducing processed foods and red meat. This question tests the LPN's knowledge of dietary management for hypertension. The keyword lifestyle changes to manage their condition points to health promotion. Reducing processed foods and red meat is a key recommendation because these items are often high in sodium and unhealthy fats, which contribute to high blood pressure. Increasing sodium, limiting fruits and vegetables, or consuming more high-fat dairy would be detrimental to managing hypertension. Emphasizing a diet rich in whole foods, low in sodium, and with lean proteins helps clients effectively manage their blood pressure. Question 25. The LPN is caring for a client with a urinary catheter. Which observation requires immediate intervention? I. Clear. Yellow urine draining into the collection bag. B. The collection bag is below the level of the bladder. C. The client reports slight discomfort at the insertion site. D. The tubing is kinked, and no urine has drained for 2 hours. Answer D. The tubing is kinked, and no urine has drained for 2 hours. This question assesses the LPN's ability to identify critical issues related to urinary catheters. The keywords immediate intervention and tubing is kinked, and no urine has drained for 2 hours highlight a significant problem. A kinked catheter tube prevents urine drainage, which can lead to bladder distension, discomfort, and potential kidney damage or infection if prolonged. Clear urine and the bag being below the bladder are normal findings, and slight discomfort can be expected, but a lack of drainage due to a kink requires immediate correction to restore urine flow. Always ensure catheter tubing is free from kinks to maintain proper drainage and client comfort. Question 26. The LPN is reinforcing teaching about proper body mechanics for a client who will be providing home care for a family member. Which statement indicates the client understands correct body mechanics? I should lift with my back, not my legs, for stronger support. B. It's okay to twist my body when moving things from side to side. C. I will keep the person I'm lifting as close to my body as possible. D. I should reach across the bed to move the person if it's quicker. Answer C. I will keep the person I'm lifting as close to my body as possible. This question tests knowledge of proper body mechanics, which is essential for preventing injury when lifting or moving clients. The statement, I will keep the person I'm lifting as close to my body as possible, indicates correct understanding. Keeping the load close to the body reduces leverage and strain on the back muscles, utilizing the stronger leg and arm muscles. Lifting with the back, twisting, or reaching across the bed all increase the risk of musculoskeletal injury. Always remember to use your legs, not your back, and keep the load close to maintain a stable center of gravity. Question 27. The LPN is preparing to administer insulin subcutaneously. Which site is most appropriate for a subcutaneous injection? I. Deltoid muscle. B. Ventrogluteal muscle. C. Outer aspect of the upper arm. D. Rectus femoris muscle. Answer C. Outer aspect of the upper arm. This question assesses the LPN's knowledge of appropriate injection sites for subcutaneous medications. Subcutaneous injections are given into the fatty tissue layer, just beneath the skin. The outer aspect of the upper arm, along with the abdomen, at least 2 inches from the navel, and the anterior thighs, are common and appropriate sites for subcutaneous injections, such as insulin. The deltoid, ventrogluteal, and rectus femoris muscles are used for intramuscular injections because they are muscle tissue, not subcutaneous tissue. Choosing the correct site ensures proper medication absorption and minimizes client discomfort. Question 28. A client on a low-sodium diet expresses frustration about the lack of flavor in their food. Which suggestion should the LPN offer? I. You can add a little bit of table salt. It won't hurt. B. Try using herbs, spices, lemon juice, or vinegar for flavor. C. Processed foods often have good flavor without much salt. D. Just focus on the health benefits, not the taste. Answer B. Try using herbs, spices, lemon juice, or vinegar for flavor. This question assesses the LPN's ability to provide practical and helpful dietary advice for clients on restricted diets. When a client on a low-sodium diet complains about bland food, suggesting the use of herbs, spices, lemon juice, or vinegar offers effective, healthy alternatives to enhance flavor without adding sodium. Adding table salt, recommending processed foods, which are often high in hidden sodium, or being dismissive are inappropriate and counterproductive. Empowering clients with flavorful alternatives improves their adherence to the diet and overall satisfaction. Question 29. The LPN observes a client's wound dressing is saturated with serosanguineous drainage. What is the priority action for the LPN? I. Document the observation in the client's chart. B. Reinforce the existing dressing with a fresh one. C. Remove the saturated dressing and apply a new, clean dressing. D. Notify the primary healthcare provider immediately. Answer C. Remove the saturated dressing and apply a new, clean dressing. This question tests the LPN's prioritization skills regarding wound care. The keyword priority indicates the most important immediate action. A dressing saturated with serosanguineous drainage means it can no longer effectively absorb exudate or protect the wound, increasing the risk of infection and skin maceration, softening due to moisture. Removing the saturated dressing and applying a new, clean dressing directly addresses this issue by providing a fresh, absorbent barrier. While documentation and provider notification are important, the immediate physical management of the wound takes precedence to maintain its integrity and prevent complications. Question 30. A client is receiving oxygen therapy via nasal cannula at 2 liters per minute. The LPN observes the client's skin around the nares is dry and irritated. Which intervention should the LPN perform? I. Discontinue the oxygen therapy. B. Apply a water-based lubricant to the irritated area. C. Increase the oxygen flow rate to improve humidification. D. Switch the client to a non-rebreather mask. Answer B. Apply a water-based lubricant to the irritated area. This question assesses the LPN's ability to manage common complications of oxygen therapy. The keywords dry and irritated skin around the nares from nasal cannula indicate skin integrity issues. Applying a water-based lubricant, such as a petroleum-free cream or gel, can help soothe and protect the skin from dryness and irritation caused by the oxygen flow and friction from the cannula tubing. Discontinuing oxygen or increasing the flow rate are inappropriate, and switching to a non-rebreather mask is a different oxygen delivery method not directly addressing the skin issue. Always prioritize comfort and skin integrity for clients receiving oxygen therapy. Question 31. The LPN is caring for a client who is confused and attempting to remove their intravenous line. Which action by the LPN is most appropriate to ensure client safety? I. Explain to the client why the 4 is necessary. B. Apply soft wrist restraints immediately. C. Engage the client in a distracting activity if safe. D. Request an order for a sedative medication. Answer C. Engage the client in a distracting activity if safe. This question addresses managing a confused client at risk of self-harm, specifically removing in 4. The keyword most appropriate to ensure client safety guides the choice. Engaging the client in a distracting activity, such as simple conversation or an activity they enjoy, is a less restrictive and often effective approach to redirect their attention away from the 4 line. Restraints should be a last resort after less restrictive methods have failed and require a physician's order. While explaining may help, a confused client may not understand, and sedatives also require an order. Always try the least restrictive measures first to ensure safety while preserving dignity. Question 32. A client has been prescribed a new medication and asks the LPN about potential side effects. Which information should the LPN prioritize in their explanation? I. Every possible side effect listed in the medication guide. B. The most common and serious side effects to watch for. C. Only the mildest side effects to avoid alarming the client. D. To look up all side effects on the internet. Answer B. The most common and serious side effects to watch for. This question assesses the LPN's role in client education regarding medication side effects. When discussing potential side effects, the LPN should prioritize explaining the most common and serious side effects. This empowers the client to be vigilant for significant adverse reactions without overwhelming them with an exhaustive list of every minor possibility. Providing clear, concise, and critical information ensures client safety and compliance. Telling them to look it up themselves is not adequate, and only mentioning mild side effects can be misleading and unsafe. Question 33. The LPN is preparing to administer a subcutaneous injection of heparin. Which technique is most appropriate for this medication? I. Aspirate for blood return before injecting. B. Rub the injection site vigorously after injecting. C. Inject into the abdomen, rotating sites. D. Use the deltoid muscle for injection. Answer C. Inject into the abdomen, rotating sites. This question tests specific knowledge about administering heparin, an anticoagulant. For subcutaneous heparin injections, it is most appropriate to inject into the abdomen, at least 2 inches from the navel, and to rotate injection sites to prevent tissue damage and promote consistent absorption. Unlike most IM injections, aspiration, pulling back on the plunger to check for blood E, is generally not recommended for subcutaneous heparin to avoid hematoma formation. Also, rubbing the site vigorously after injection should be avoided as it can increase bruising. The deltoid muscle is for intramuscular, not subcutaneous injections. Question 34. A client reports feeling constipated. The LPN reviews the client's dietary intake. Which food group, if consumed minimally, might contribute to constipation? I. Whole grains. B. Fruits and vegetables. C. Processed snacks. D. Lean proteins. Answer C. Processed snacks. This question assesses the LPN's understanding of dietary factors influencing bowel elimination. The keyword constipated points to a need for dietary changes that promote regular bowel movements. Processed snacks are often low in fiber and high in refined carbohydrates and unhealthy fats, which can contribute to constipation because fiber is essential for adding bulk to stool and facilitating its passage. Whole grains, fruits, and vegetables are rich in fiber and help prevent constipation. Encouraging a diet rich in fiber and fluids is key to preventing and managing constipation. Question 35. The LPN is observing a new nursing assistant perform oral care for an unresponsive client. Which action by the nursing assistant requires immediate intervention by the LPN? I. Positioning the client on their side. B. Using a soft toothbrush to clean the client's teeth. C. Placing a towel under the client's head. D. Performing oral care with the client lying flat on their back. Answer D. Performing oral care with the client lying flat on their back. This question tests the LPN's ability to identify unsafe practices, specifically concerning an unresponsive client's oral care. The action requiring immediate intervention is performing oral care with the client lying flat on their back. This position poses a significant risk of aspiration, inhaling fluids or debris into the lungs, for an unresponsive client, as they cannot protect their airway. Positioning the client on their side, using a soft toothbrush, and placing a towel are all correct and safe practices. Always ensure an unresponsive client's head is turned to the side, or the head of the bed is elevated during oral care to prevent aspiration.